guys, let's take a second to chat about nosebleeds. As the weather gets cooler and the humidity in the air drops, we see a lot of nosebleeds. So especially this time of year, it's something that we're seeing a bit more prevalently. So I just wanted to talk about nosebleeds and what causes nosebleeds and what we can do to prevent nosebleeds. So as I mentioned, dryness in the air, dryness in the mouth or the nose in general, sleeping with the heater on, that decreases the moisture on the inside of the nose, and that can make the mucous membranes a bit irritated, and that can lead to a spontaneous nosebleed. Of course, we can also see nosebleeds with any nasal trauma, picking of the nose, rubbing the nose like this or like this. Sometimes it's the simplest motion, but nosebleeds often come from an area in the very front of the nose called Kieselbach's plexus, and it's an area where about 4 or 5 major blood vessels converge. And so that's why just the slightest movement to the tip of the nose can often be the onset of a nosebleed with just a simple movement. But the third thing that can cause a nosebleed is allergies and sinus infections. So anything that causes the mucous membranes on the inside of the nose to be irritated can make it easier for the nose to bleed. So as you breathe in things that your body perceives as foreign, either in the form of an antigen or a virus or a sinus infection, the blood vessels on the inside dilate in an attempt to release mucus to try to make a wave to clear the foreign antigen. So if you have chronic allergies or chronic sinus infections, the nose is inflamed on a regular basis, that makes it easier for nosebleeds to be propagated. So especially if you have nosebleeds that come and go with seasonal changes, allergies are something that people don't often correlate with nosebleeds. So managing your allergies can definitely help to decrease nosebleeds. And then the other thing that's a big factor in nosebleeds is medications. So sometimes you take medications that thin the blood that can make nosebleeds occur more frequently. Sometimes medications can be drying. So managing your allergies by taking an over-the-counter antihistamine sometimes has a drying effect, and we do want to manage the allergies, but if you have an antihistamine that causes dryness to the nose, that can make the nosebleed worse. So when we first have a nosebleed, some simple things that we can do to try to stop the nosebleed are to use moisturizing agents such as moisturizing saline sprays, or Neomed has a nasal gel that you can apply to the tip of the nose and occlude the nostril. And what the moisturizing agents do is they try to make a protective barrier on the inside so that the inflammation of the mucous membranes is not so close to the surface. And that can help coat the area and soothe the area and prevent nosebleeds. If you get an active nosebleed, pinching the tip of your nose, of course, putting pressure on that area of Kieselbach's plexus can help. It can help to eat ice. You know, the top of your mouth or the roof of the mouth is the floor of the nose, so eating ice can have a vasoconstrictive effect, as well as putting ice on the outside of the nose. But as an ENT physician that specializes in the treatment of allergies, I often go through the process of obtaining a history. And I often find that patients have significant allergies that aren't treated. And I find that by managing the allergies, whether through over-the-counter allergy medications or starting immunotherapy to stop the body from holding on to inflammation, is one of the simplest ways that we can prevent nosebleeds from coming back in the future. So just something to think about. I know that people don't often make the correlation between allergies and nosebleeds, but if you have allergies and you continue to get recurrent nosebleeds, it's definitely something to think about.